Welcome, everyone, and thank you for joining us tonight. And welcome to this expert education presentation from the Sash Bear Foundation. Now, the Sash Bear Foundation is a Canadian charity that is recognized nationally and internationally as a leading voice for families impacted by emotion dysregulation, suicidality, and related mental health challenges. You may know us for the Family Connections program, which we provide across Canada. For these expert education series presentations, for our annual Sash Bear Awareness Walk that we hold every spring in cities across Canada and in a couple of cities in the fall as well, or for many other activities raising awareness for mental health and providing skills and hope for families. You can always go to our website, and you can also follow us on social media to learn more and see how we are making waves across Canada each and every day. Now, as I mentioned, Sash Bear is a registered Canadian charity, and as a charity, we depend on donations for much of the funding to do our work. And Kathleen, I think there's a slide that has the QR code. Perfect. So we do ask that if you're able to make a donation, please do so. If every person attending tonight were to make just a $5 donation, that would make such a huge difference in our small budget. So I ask you to please consider donating. There's lots of information there. You can donate through our website or scan the QR code that's on the screen. You can even choose to become a monthly donor with just a small amount every month on a regular basis. Really can make a big difference as we provide support, skills, and education for family members to support their loved ones. Leila Guller, PhD, is a therapist at the 3 East Residential Programs in Boston. Dr. Guller's clinical work is primarily with young people struggling with borderline personality disorder and risky behaviors. Her research background is in adolescent addictive behaviors. Dr. Guller completed her graduate training at the University of Kentucky and completed her postdoctoral training at McLean Hospital and Harvard Medical School. Welcome, Leila. We are so happy to have you with us here tonight. I will turn the floor over to you.
Thank you, Doreen. I am so happy to be back doing a webinar for Sash Bear. All right, so the title of my talk is Supporting Family Members with Substance Use Disorder, Reinforcement and Contingencies. So a little overview of what we're going to be talking about today. I'm going to give a very, very brief overview of substance use disorder. I want to give an intro to behaviourism, so principles of reinforcement and punishment, because it's really helpful for us to be aware of how our own reactions to the people around us who we love, who are struggling with substance use, can shape the way they respond to us. I then am going to go into some traps that we tend to fall into around reinforcement and punishment, and then review some alternative strategies for using positive reinforcement and contingency management effectively. And lastly, I'm going to give you some resources that are available out there if you want further support in contingency management, positive reinforcement in those areas in dealing with substance use. One thing I want to say is today, the intention of my talk is really to just get people thinking about their own behavior. I do not by any means expect anyone to leave today suddenly being an expert in how to do this. It's very, very hard. I have been teaching this for a long time, and even I have trouble doing this with my own family members. So today it's really just to start getting people thinking about, ooh, I might be doing this thing that might be contributing to this behavior continuing, and I might not be reinforcing the things I mean to contribute or mean to reinforce. And then I'll give you resources at the end if you feel like, oh my gosh, I need way more support in this. All right. So very quick overview on substance use disorder. These are the stats in the United States. But substance use disorder is common. Nearly 1 in 5 people ages 12 or older meet criteria for substance use disorder in the past year. Can people see that? I'm just sliding my thing around. And of course, that when you have a family member that's using substances and has substance use disorder, it takes a really large toll, right? I think if you're here, you probably have some awareness of what this is like, but there's a huge emotional toll, right? When you love someone who's struggling with substance use, you're angry, you're scared, you're hopeless, you're numb. You go through the whole range of emotional challenges that one would experience when dealing with someone who is struggling in this kind of way. And I think in particular, substance use disorder is really hard. I think it's much easier to come by judgments, where we tend to have judgments that people are being really hedonistic in their actions. And it's really easy to fall into sort of anger disappointment, and the whole range of emotions. Of course, there's a huge relational impact. It's easy to get into fights with people who are struggling with substance use disorder. That's pretty obvious. And of course, there's an economic impact, whether it be that you are giving people money to fund their addiction, or you're getting them in and out of rehab, or you're paying for them to get out of some type of incarceration. There are huge economic impacts when you have a family member that struggles with addiction. Usually one of the things family members run up against is they really, really want to get their family member into treatment, right? The person who's using substances, you're like, oh, if I could just get them to treatment, if I could just get them help, if I could just somehow get them to see that it's a problem, we get really, really pulled into wanting to push them towards a treatment setting. People often hear this term enabling a lot as well. When we're talking to a loved one with substance use disorder, when we're supporting a loved one with substance use disorder, you think about this term enabling and it comes up a lot. And the question is, what does that actually mean? Like, what are we doing when we enable? And that's a really nice transition into these basic principles of behaviorism that I want to introduce people to. Like I said, I really want people to start getting a sense of what they might be doing to reinforce. And I want to give just a 2-slide introduction to this principle called behaviorism in psychology, which is reward and punishment. So I'm going to go to the next slide, and I'm specifically talking about operant conditioning, which is shaping behavior through reward and punishment, reinforcement and punishment. And I want to say that I do not expect anyone to have a perfect understanding of this. This would be several hours of classes in a Psych 100 class, and I just want to give a very brief overview. So what is positive reinforcement? So positive reinforcement is when a person gets something they want, an outcome that's wanted. The positive does not necessarily mean good or bad. Positive means the presence of something, kind of like the flu. If you're positive for flu, it means you have the flu. So positive means giving something, presenting something. Reinforcement means it is wanted. So the classic example, you're teaching your dog to sit, you take out a treat when they sit and you give them the treat. You positively reinforce the sitting with the treat. Negative reinforcement, the negative is absence, right? So you are taking away, and it is something that is unwanted. So it is reinforcement, right? So if you take away something that is unwanted, it's negative reinforcement. So the classic example of this is you click a seatbelt in because there's this annoying beeping that happens. So you don't have your seatbelt in, you start to drive, beep, 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 super annoying. You click your seatbelt in, it goes away. You are negatively reinforced for putting your seatbelt in, meaning that annoying sound goes away, relief, right? Negative reinforcement, taking away something unwanted. On the punishment side, positive punishment, again, the positive means presenting with something, means you are giving something unwanted. Classic example is yelling at someone, right? If your dog, he's on the rug, you say, stop it, don't do that, right? Yelling would be an example of positive punishment. On the other end, negative punishment, negative taking away, something unwanted, or excuse me, something wanted, right? So when you remove something that is desired, that is negative punishment. And an example of that is like saying, you're not getting any dessert after dinner, right? I'm taking away the dessert, you want the dessert, negative punishment. For our more visual learners, once again, I don't expect people to walk away having a perfect distinction in their mind between negative versus positive punishment. But generally, the main point I would love folks to take away from this is that reinforcement, as you can see in this top green row that I'm circling here, reinforcement increases behaviors, right? So if you're using positive reinforcement or negative reinforcement, the outcome typically means their behavior increases over time. Whereas on the bottom row, the punishment row, that red row, the behavior would decrease over time. Reinforcement increases behaviors, punishment decreases behaviors. That's sort of the main point I want taken away. I don't expect anyone to really get the 4 different categories perfectly. So, pop quiz. You're lucky because I can't really see you guys. I can't fully put you on the spot, but I'd love to hear the chat responses. So, your kid keeps shouting. I like using an early childhood example. It's less complicated. I like this because I think this is a universally applicable example to anyone that's ever been around a kid. So your kid keeps shouting every time you try to have a conversation with your spouse at the dinner table. Every time it happens, you shout, "Stop, that's so annoying." The first night, he does it 2 times. The second night, 5 times. The third night, 9 times. Every time you yell, "Stop it." What is happening when you yell stop at your kid? Positive reinforcement, giving something wanted. Negative reinforcement, taking away something unwanted. Positive punishment, giving something unwanted. Or negative punishment, taking away something wanted. And I'd love to see, I don't know if I can see the chat. Let's see. Oh yeah, this is exactly, ooh, we're seeing a mix, seeing a mix. Ah, some of you knew this was the truth. Love it. Okay. I'm getting like a lot of C's, but some A's. Ugh. Thank you guys so much for all putting your answers in the responses. This is great. Okay. I'll jump back to this. So, oh, well, I gave you the answers, but I'll go back. Okay. So there we go. Well, I already gave you a sneak peek while I was clicking on the chat. So most people, and by the way, so you don't feel bad about this, this is a trick question that they give us on our psychology licensing exam. So there are lots of PhD level psychologists that get this wrong. Most people say C. Most people say it's positive punishment, right? I literally just in the last slide said yelling is a form of positive punishment, right? That was the actual example I gave. You're supposed to trust me. I'm talking here. I'm giving the talk. But the thing is, what's happening with the behavior, right? The behavior is increasing, right? And if you remember in the last slide in that green category, if a behavior is increasing, it's likely we're reinforcing it. So it's not punishment, right? Even though you would assume yelling is very much an unwanted thing, it's probably not punishment. It's also not negative punishment. You're not giving something away. So as you saw, I kind of ruined my slide, but that's okay. It could be positive reinforcement, right? Think about little kids. Think about like a 4-year-old. All they really want is attention. I saw one person in the chat put it's attention, so it's positive reinforcement. And that is absolutely correct. Most kids, when they're around their parents and their parents start talking and they leave them out, most kids get a little tense. They get like, oh, I want attention, right? They sort of get a little wormy in their bodies and they'll kind of do anything to get attention, negative or positive. Younger kids kind of don't discriminate between positive or negative attention so well. So kids do this a lot. My kids both did this when they were this age. They would go, ah, and just start yelling. And we'd do exactly what I gave in the example, and it wouldn't work, right? They would do the behavior more. And that's because you are giving attention, even though it is not positive attention, but it's reinforcing to them because they're getting attention, right? It can also be negative reinforcement, right? If you think about taking away something unwanted, think about that little kid feeling tense in that moment, like, oh, they're not paying attention to me. I want attention. Like mommy and daddy are talking to each other. I want attention. So they get that building tension. And the second you break your gaze with your spouse and look at your kid and give them that big response, you take away the feeling of being ignored, right? So you're taking away something unwanted. So you could be positively reinforcing by giving attention in general and negatively reinforcing by taking away the anxiety of not being paid attention to. So I really love this example because I think it really effectively highlights that we all can accidentally reinforce the wrong things and we don't realize we're doing it, right? So sometimes we think we're doing something that may be punishment, like I'm yelling at him, this should be aversive to him. Why is the behavior not stopping? When in reality, it actually might not be punishing to the kid. I think that we tend to do this in the framework of substance use, and I'll get to that in a little bit, but it's just a really helpful example to get us thinking about how we might be inadvertently reinforcing things we don't mean to. I have a colleague who once said, if you're a parent and you keep doing the same thing over and over and over again, and it's not working, you're the one who isn't learning, right? It's not your kid, it's actually you, right? If you think like, why isn't this working? Why isn't it working? It's probably because you're not quite learning in that example. So I really like this example. Okay. So I want to talk a little bit about common reinforcement traps we fall into and punishment traps we fall into specifically when we have family members that are struggling with substance use disorder. So I mentioned this word enabling before, and that brings us to the question, what is enabling, right? And I'm taking my definition from Hazelden Betty Ford, and enabling is behavior that can inadvertently reinforce substance use behaviors. And this can include protecting family members from consequences of addiction. So an example of this might be a woman wakes her husband up every morning because he never wakes up on his own because he's drinking really heavily the night before. And she wakes him up because she doesn't want him to be late to work and she doesn't want him to be in trouble, right? This could be a parent whose son goes out partying really late every Friday and she drags him out of bed on Saturday morning to make sure he gets to soccer so his friends aren't mad at him, those types of things. Protecting from consequences. Keeping secrets, this is a really big one. This can be, I've seen kids keeping secrets from parents on behalf of the other parent. I've seen parents keeping secrets from each other. I've heard immediate family keeping secrets from extended family. And keeping secrets, again, protects our family members from consequences by not shining as big of a light on the behavior as might be warranted. And it can help them kind of just keep going unnoticed. Not following through on boundaries or consequences. So let's say a husband tells his wife every weekend they go out and they get dinner, and every weekend she gets way too drunk at dinner. And he says, like, I'm not going out to dinner with you again. And then they go out to dinner the next weekend over and over, right? It teaches people to kind of discard the consequences that are threatened, right? I've seen families say things like, you're not going to be allowed to see any of your friends on weekends, but their parents who go out every weekend and their kids are like, all right, good luck enforcing that. You're not even home most weekends. Like, how are you going to know if I'm seeing my friends? So not following through on boundaries or consequences can certainly reinforce or enable substance use behaviors. Making excuses. So this can look like making excuses for yourself, like on behalf of the other person. So I've worked with parents who say things like, well, don't all adolescents drink heavily? And I'll have to explain to them, like, the way your kid is doing it is really off the charts in terms of frequency and amount. So people can sort of be in denial themselves. You can also make excuses on behalf of the person to others. So grandma notices that your kid shows up and their eyes are really red at Thanksgiving dinner, and you know they're probably high, but you say like, oh no, she's been studying for her exams, she's just really tired, right? Making some excuses. And again, that protects from more light being shown on the behavior. And then I see a lot of people avoiding talking about the problem at all. I'm actually blown away by how many teenagers I work with who think they are so slick in terms of hiding their substance use disorder from their friends. They're like, oh, nobody knows. And then they get sober and they tell their friends, and all their friends are like, yeah, you were really weird this last year. And they're like, what? I thought I was hiding it so well. And it's just because no one says anything about it. So people think they're getting away with things. Also, people in family systems tend to avoid talking about problems because they're worried about people blowing up. They're worried about their family members hiding things from them. And I'll get into this in a later slide. There's ways to talk about stuff that reduces the likelihood that it blows up. So, but all of these things can lead to some enabling. On the other side, so that was on kind of reinforcement. On the punishment side, it's so easy, and no judgment to anyone that gets pulled into this. It is very easy to get punishing very quickly when you love someone who's struggling with addiction, right? So what I see a lot of families do is like pleading. So they have a family member who has some major negative consequence. They, from their substance use, they show up to a family get together and they're totally intoxicated and it's really embarrassing. And the next morning they're like, please, can't you just like get it together for me? Like whatever, pleading kind of behavior. And of course, I love this picture, typically, especially when it's a parent, but any family member, spouse, grandparent, aunt, uncle, when they engage in that type of behavior, they close their ears very, very quickly. And it tends to sort of punish like any self-reflection the person might have otherwise. I see a lot of lecturing. And it's so easy to do this. Again, I have nothing but empathy for this type of situation. I myself have done this with clients. I've done this with family members. When someone is really active in their addiction and it feels to you like they're just not getting it or seeing it, it's so easy to be like, you've come home, a high 7 times this week, every day. You seem like you're still like, that's not normal. Like, just getting into like, if I just prove to you that it's a problem, then you'll know it's a problem. It's very easy to get pulled into wanting to prove to someone or lecture them or give them talks about how big of a problem they have, because it really does feel like if you can just convince them, then they'll be like, oh yeah, I do have a problem, but it doesn't work that way. Of course, it's easy to lose your temper, right? I don't know if I need to say too much on that one. Substance use comes with a host of really negative consequences and often very public consequences. It's really easy to get angry, right? And yell at someone. If your kid comes home and throws up all over your carpet, it's very hard to approach them calmly. It's much more likely that you're going to be like, are you kidding me? Right? Losing your temper. Vindictiveness, this kind of captures a large range of behaviors. I don't mean it in a mean way, but typically families can get pulled into wanting to prove points with their loved ones that are struggling with substance use. So very extreme examples I've seen, this of course can include things like dumping alcohol down the sink in front of the person who's struggling. I've seen parents take their kids' stash of drugs and actually get high on it to show their kid what they look like when they're high, right? Those are sort of more extreme examples. But it can also look like giving the cold shoulder very purposefully. Like, I want to show you how much you hurt me with your behavior. I need to prove to you how much you've hurt me, right? Okay. And then the most common one, I think, of all of these are common, but what I typically see a lot with parents especially is these over control behaviors. So this is like going through possessions the second they leave the house, like going through all their pockets, going through their phone, going through their backpack, right? Throwing things out, limiting access to social activities, privileges. I'm taking your phone away for weeks, right? The over control behaviors, people get really, really pulled into them. Right. I'm going to randomly search your stuff. I'm going to drug test you randomly. And I'm going to stand there and we're going to have a huge fight every single time. But I need to know whether you're using substances or not. Right. It's really easy, again, because part of substance use is people tend to hide it. Right. People don't want to be caught because they don't want to hurt the relationship. It's not really for negative reasons most of the time. Oftentimes they don't want to stop using, but people don't want to be found out. And that pulls us into these really over controlling behaviors, but they tend to backfire, right? That's why I put misfired at the top. So one more pop quiz. I know, not this again. Okay. You get a call from your kid's school. A nicotine vape pen fell out of her pocket during class and was spotted by her teacher. Now she has a 2-day suspension from school. When your kid gets home, you make her sit with you while you go through her entire room, throwing out every nicotine vape pen you find. You start weekly room searches moving forward. This is not a multiple choice. So this is more of a discussion, but I'd love to see in the chat. What behavior are you punishing? And what behavior are you reinforcing? See the chat. Oh, there's the chat. Oh yeah, you guys are catching on. Yeah. Oh, look at you. You're all experts now. Absolutely. Yes. Okay. Yes. Oh, punishment for the illness. Yeah. Yes. Oh, yeah, you're punishing yourself too. I love that. Yeah, absolutely. Oh, yeah. I wouldn't even thought of it. Okay. I think you all aced this pop quiz. A+ is all around. So you tend to be punishing openness, right? Because when you establish this kind of stance between you and a loved one, where it turns into a police state, the way it feels to the other person is like they're just waiting for me to mess up. They don't trust me. They're mad at me, which PS might be totally true. Like you might have zero reason to trust and you might be really angry. But when that sort of stance gets established in a pretty ongoing way between two people, you kind of punish openness. You do also punish, lots of people are right in saying you punish the vape falling out. But I love that a lot of people said you're punishing getting caught, which might not be the thing you want to be punishing. And almost everyone got this one. What you're reinforcing is like hiding behaviors or lying behaviors, right? Makes sense. So typically, like in this example, it's really unlikely that weekly room searches would prevent someone from having a vape, right? What you're probably going to teach them to do is have better hiding spots. So maybe they keep their vape like on their person at all times moving forward. And you are negatively reinforcing them by, so think about this, you're in the room with them, they're like anxious every time you're searching. They're like, please don't find it, please don't find it, please don't find it. And then they get this huge wave of relief when they have successfully hidden the implements, right? So you're negatively reinforcing the hiding behavior. And I will say that when we get into this over control kind of constant searching to find people out and catch them, they just get really, really good at hiding things over time. So not to blow up any teenagers' methods here, but the things I hear very frequently, for example, are lots of teenagers I work with, their parents track their locations on their phones, and maybe they'll get in trouble once and their parents are letting them go back out and they're going to have their first sleepover at their friend's house. And they say, okay, I'm going to be tracking your location. So I know that you're not going out. You're only allowed to be at Emily's house tonight. You can't go out to any bars or anything. And a lot of kids I've worked with have learned to just sync their track my iPhone to their iPad, and they bring their iPad to their friend's house and they leave their iPad at the friend's house, and then they go out drinking at the bar, right? Or go out wherever they go. And so the parents are sitting there at home looking at their iPad or looking at their location. They're like, oh, my daughter must be asleep. That's so great. It's so still. The dot hasn't moved in an hour. And meanwhile, the kid just left the iPad at her friend's house, right? When it comes to technology, teenagers will always be better at it than we are. And I've seen really, really creative hiding strategies over the year. I've seen, this was someone I knew, not a patient, but she would hide her stash of substances. She would unsew the inner lining of her jackets and attach Velcro to the lining, and then put her stash in the lining of her coats and then re-Velcro it shut, so that if anyone went through her pockets or her things, they wouldn't find it, right? So there's no shortage of creativity when it comes to hiding things for people. And the more we get into over control behaviors, the more likely it is they will hide. You guys all did great on that. So what do you do instead, right? If we don't want to enable and we don't want to get stuck in sort of the angry lecturing police state cycle, what do we do? So one thing we really want to focus on is positive reinforcement, right? Trying to give more rewarding interactions to the other person, right? As we know, positive reinforcement is giving a more desired outcome. And when we're trying to switch our relationship and switch our behaviors around someone who is dealing with a substance use disorder, we want to use a lot of positive reinforcement. So you want to find activities that the substance user finds enjoyable. So going back to that example, husband and wife, their typical activity is going out to dinner, but every time they go out to dinner, the wife gets really, really drunk and it's a big fight and it stinks. You know, how about don't go out to dinner for a while, right? How about finding some other enjoyable activities that you can do together that don't involve any alcohol you can do during the day. Now, this is a very different landscape for adolescents, because adolescents don't typically, most of the time, not always, want a ton of quality time with their parents. Adolescents typically want a lot of independence. So for adolescents, if you're a parent, positive reinforcement typically looks more like giving more privileges, giving more freedoms, right? So for an adolescent, it might be, okay, like you have had trouble getting to school this last week a couple times because you've been smoking too much weed. So we can't let you go out on the weekends because it's, you know, you need that time to catch up on work. But if you get all your work in, then we can let you have the car next weekend, whatever, go out with your friends. More positive reinforcement, more privileges. It can look like extending curfew. It can look like, you know, funding hobbies, things like that. It's really nice to have reinforcers that you could do with some regularity. Of course, it's okay to have delayed reinforcers, like kind of the big things. For example, if a kid had a lot of trouble in school, saying like, if you make it through this last year of high school, we will help you get a car. If you can make it through this last year of high school, we'll be able to pay for college, whatever it might be. Those big ones are really great, but when we have very, very delayed reinforcers, it tends to be less effective in motivating sustainable long-term change. So we also need a mix of regular reinforcers, like those weekly reinforcers, like, okay, you got all your homework done this week, you can go out and have freedom this weekend, right? Makes sense. I gave some very expensive examples like the car, but you can be very creative. They don't have to be super expensive hobbies or privileges. It can be, again, like more freedoms. If that example with the husband and wife, it could be something like going hiking, right? It doesn't require a ton of money. Positive communication is another form of positive reinforcement. So one thing that's really important is when we have family members that struggle, when we do approach them, if we do choose to talk to them about it, to be pretty even keeled when we do it, right? So let's say your kid comes home for the third weekend in a row and he throws up in the toilet, the third weekend in a row, hopefully in the toilet. It would be very easy to storm into that bathroom and say like, this is the third time in a row. I'm so sick of this. You clearly can't handle your alcohol, whatever it might be, right? That conversation can wait, right? I always encourage when it comes to these tricky conversations, waiting until you yourself are in a more regulated state. So you can wait till the next day. You can approach your kid. You can say, you know, hopefully he's sobered up by then. And you can say like, sweetie, I'm really, really worried. And this is not okay that you're coming home every weekend throwing up drunk, right? You can be open and honest about how you're feeling about it. You don't guilt trip the person, but you can say like, I'm worried, honey, right? Avoid being confrontational. Again, you don't want to be in that mode of I'm catching you doing something wrong. You don't want to be like, this is the third time, right? Just try to have a loving tone. And if you do set limits, try to set them in a loving way, right? So you have this kid who's come home third weekend in a row, totally wasted, and you say something like, honey, like I'm really worried about you. You know, you might disagree with me. You might want to argue it with me. You might be angry with me, right? And because this has happened so many times in a row, for the next month, when you hang out with your friends, it has to be at our house and they have to be out by midnight, whatever time you want to say, right? Your kid might be furious, or your family member might be furious, but you want to say it in kind of that calm tone. And if your kid says, that's not fair, you're ruining my life, you say, sweetie, you can be as angry at me as you want. But I love you too much to keep watching this cycle continue. And this is what I feel like I need to do to keep you safe. And I hope you can understand that. And you can kind of repeat that as needed and walk away if it escalates, right? But positive communication does not mean the absence of limits. You can communicate in a positive way and set limits lovingly. Okay. So that's more on the positive reinforcement side of things. On the other side of things, to avoid enabling, you want to let natural consequences unfold. So you want to try to avoid swooping in to fix the problem. So let's say, like that example I gave before, you have a kid who is going to be late to soccer practice every Saturday because he's partying too hard every Friday. You know, don't wake him up. Let him be late. Let his friends be mad at him, right? This doesn't mean to let all natural consequences unfold. So obviously, if there's some type of life-threatening consequence, you do need to step in. So if you see your kid very inebriated, about to drive, that is not a time to let a natural consequence unfold. You're definitely going to want to swoop in there, take the keys, and not let that happen. But otherwise, if these things are not immediately life-threatening, let them unfold. And there are many things that we might think are going to ruin people's lives that don't, which leads me to my next point. Try to catch your own catastrophic thinking about things, right? So I've worked with countless parents who engage in a lot of rescuing behaviors because they're really focused on kind of getting their kids to the next finish line, right? So an example might be, and I've worked with so many parents that have done this, so if you happen to be someone I've worked with and you watch this, don't feel like you're being called out, but things like, I just need to get my kid through his last year of high school. I just got to get him to the finish line and get him to college. And they'll do things like monitor all their homework assignments and make sure they're getting them in on time. I've had parents write kids' college essays for them. I've had parents, call up school and make excuses for their kids when they haven't gotten things done on time because they get so caught up in their thinking about like, I just need to get to the next step that they kind of lose sight of what the problem is. And when I ask parents, why do you need to get your kid to the finish line so badly? They say, well, if he doesn't get through this year, then he's going to feel awful about himself, and then he's going to stop trying, then he's never going to get into college, and then all his friends are going to move forward without him, and he's never going to get a college degree, and he's going to live at home forever. And it's really easy to get caught up in catastrophic thinking. And to that, I always say, like, let's slow down for a second and think, if we keep doing all these accommodation behaviors with our kids, like how ready are they going to be at the finish line, right? If they haven't done a homework assignment all year because you're so insanely worried about them not getting into college, then they're not going to be quite ready when college time comes. So check your own catastrophic thinking. Sometimes catastrophic thinking is useful, right? Which is why it's important to pay attention to it. So for example, if I give that example of the wife waking her husband up for work in the morning, I would encourage sitting back and letting natural consequences play out, but that's easier said than done if you're in the type of situation where your husband has gotten in trouble at work multiple times and he has one final warning, and if he's late again, he gets fired, and then you can't pay your bills, right? So sometimes those worries might actually be found in reality, but oftentimes they are not. Or they're founded in unknown outcomes that we cannot predict. One thing that I would like to encourage everyone to do, if they are going to take a step back and they are going to start letting natural consequences unfold, please give your loved one a heads up that you're doing that. So if you are that parent that's always waking your kid up on weekends to avoid missing soccer practice, and you decide, you know what, I'm not doing this anymore, like, he can suffer the natural consequences if he wants to. Just let them know. If you've been doing it for a year and then suddenly you stop, that's going to be a huge argument. Just give them a heads up. Like, you know what, sweetie, again, with that gentle communication, you know what, sweetie, I realize that I think I'm potentially enabling you. I'm worried that I'm helping you avoid some consequences that might be useful for you. So moving forward, I'm not going to wake you up on Saturday mornings anymore, okay? And your kid might get mad and they'll say, what the heck, and blah, blah, blah. That you can say, like, I know, and this is what I need to do, right? But give them a heads up. Okay, so I've talked a bit about not swooping in. I've talked a bit about not getting pulled into unkind communication. But there is absolutely a place for consequences, especially when you're parenting a teenager. But this is also true for anyone who has an adult loved one in their lives that struggles with addiction. So there is a place for consequences. Like I said, if you have a kid that was, missed school for 2 weeks because they went out and smoked weed every day and they were driving high, you don't just say, okay, I'll just sit back and let natural consequences play out. We do need some consequences from you as well. So consequences are what you do, right? Boundaries that you set with them to shape the behavior. It's not what your family member has to do. So a consequence is something you decide to do with your own behavior, not what you're telling the other person they have to do. So a consequence might be something like, you know what, honey, like, I can't drive you to your friends' houses this weekend because every time you go there, you come back and you are super stoned. So I'm not going to drive you there. You're not allowed to see your friends anymore, because really you don't have total control over that. They might see their friends at school. They might see their friends. They might sneak out. Their friends might come pick them up, right? But what you can control is, I'm not driving you there anymore. Consequences should typically like fit the crime, quote unquote. So like if your teenager drives drunk, an appropriate consequence would be suspending car privileges. An appropriate consequence would not be taking all of their stuff, right? It should fit the crime. Another example, if you're giving your kid money for lunch and they're spending it on drugs, don't give them money. And I know this one can be really scary for families, because I always get the follow-up question, well, what will they do then to get money? Parents is where the catastrophic thinking comes in, and it may or may not be true. Parents tend to really worry that their kids will turn to less savory forms of getting money. And it's really, really hard to enforce this consequence of not giving money. But you can try to use some positive reinforcement to like help them find a job, help them get more independence, help them get money on their own, and then you don't have to monitor their spending money. And if they have their own job and are holding it down, hopefully that means they're not abusing substances in the same way. So general guidelines on rewarding consequences. One thing is they should be time limited. When you're setting consequences, you should tell them how long the consequence is occurring for. So you don't want these endless stretches like you're never getting your phone again, right? It should be a very time limited consequence. So if for the phone example, you were sending pictures to make money to fund your drugs, like we are taking your phone away for the next month and we will reevaluate at 1 month. Consequences should be realistic. So do not threaten consequences if you can't follow through. So for example, if you are someone who lives in a rural area and you work really long shifts at the hospital and you have no reliable family or friends that can drive your kid around and your kid has to drive themselves to high school, you can't say like, you're not allowed to have a car anymore because you actually probably could not follow through on that, right? They should be things you're able to follow through on. Same thing with the example I gave earlier. I've had parents that say like, we're gonna not let you go out on weekends. And then their kid says you travel many, many weekends out of the year. How are you gonna be able to do that, right? Rewards and consequences should be in your control, not in the other person's control, right? So like I said, like I won't give you rides anymore is very much in your control, but you're not allowed to see XYZ person is not in your control. So they should be things that are within your own control. Most importantly, rewards and consequences should be based on behavior that is behaviorally specific and observable by you. And they should not require a bunch of detective work to find out. So what I mean by that is, I'll give an example. I always change this example slightly to protect privacy, but I worked with someone who came to residential treatment, and before treatment, they had been using a lot of different drugs, oftentimes very illicit substances, and they were also using marijuana with some regularity. And when they were about to discharge from treatment, their parents said, like, you can't have the car unless you're totally clean. Like, you cannot use our car unless you're completely clean. And the teenager was like, well, I don't plan on stopping weed. I'm planning on smoking on the weekends. And they're like, well, that's fine, but we're going to drug test you for you to have the car. And the kid's like, well, and that they really got into this back and forth about catching the behavior. And first of all, like we talked about before, forcing drug testing will likely lead to hiding behavior. I've heard lots of ways people can obtain urine and use all sorts of contraptions to make it look like they're peeing. I mean, people get very creative. And honestly, at the end of the day, the parents couldn't actually know if the kid was using substances or not. They couldn't observe it with their own eyes. And what we came to was what they could look at instead of are you using or not using, because that was such a nebulous question, was is the kid functioning in areas that you can see, right? So when the kid was abusing a lot of harder drugs, they were not really like getting any homework. They weren't getting any for their homework assignments in. They weren't getting to their job. They weren't leaving their room. They weren't seeing friends, right? So what we shifted this to was, rather than parents having to figure out if their kid was using or not, it was, are you functioning? If you are getting all your homework assignments in for a month, you can have the car. If you are getting to work every weekend when you need to, you can have the car. If you're not like oversleeping and missing things, you can have the car, right? So setting forth rewards is really most effectively based on these observable, measurable behaviors that you with your own eyes can see and don't require you playing detective in any way. I know I mentioned drug testing, and I always get questions about drug testing. What we know from research is drug testing can be effective if the person who is using is the one requesting it. So if you have a kid or a loved one or any other family member who is saying, I really want to get clean, I really want some accountability, I want my psychiatrist to drug test me once a week and I want him to send the results to you, great, go for it, that is wonderful. But drug testing is pretty ineffective when it's like mandated on the person. So if you tell, like the example I just gave, you have to have clean drug tests in order to get XYZ things, there's mixed research on whether that's actually effective or not, or whether that leads to more hiding. So yes, drug testing can be an option, but the person really has to be on board with it, and they have to really want to get clean. Okay, so I talked a lot about what you should try to refrain from, what you should try to increase, and it's really, really hard to do this stuff. So I just wanted to give people some resources on how you learn more. So there's a very cool therapy modality out there called community reinforcement and family training. It's called CRAFT. And CRAFT is a model that helps family members increase the likelihood that their loved one gets into treatment for substance use disorder. And it particularly aims to work with people that are resistant to the idea of treatment, right? It works entirely through the principles I just talked about. So it really targets positive reinforcement of non-substance using behaviors, contingency management around substance using behaviors, and increasing positive communication to get people into treatment. It has a very high success rate in getting family members into treatment, a 64% success rate. And if anyone's interested in learning more about this, you can go to the website We the Village, and they have some really nice resources for families, ranging from pretty brief webinars all the way up to more intensive trainings that you can go to on a weekly basis. There's also Al-Alon, which I really, really like Al-Alon. I think that Al-Alon is a program. So Al-Alon, to introduce people to it, is a 12-step program. And it really focuses, and it's for family members of people who are struggling with addiction. It's very helpful for the self-care side of things. So it helps you sort of focus on yourself, stop trying to constantly clean up after and take care of the person who is using, and it focuses on sort of like yourself, right? I think it's a wonderful program for connecting people with other family members who are struggling with similar issues. One thing that tends to happen when we have someone in our family with an addiction is it can be pretty isolating, and we can hide it, and it creates some shame and whatever might happen. And being able just simply to talk to people that are struggling with the same thing can be very helpful and healing. And I'm sure a lot of people here can relate to that. The thing about Al-Anon that is different from CRAFT is that it's entirely acceptance-based, right? So it focuses on yourself, it focuses on your own self-care, not getting pulled into over-control, but it does not have anything that is designed to change the behavior of the person struggling with addiction, right? So there's nothing in Al-Anon that targets like, how do you positively reinforce? How do you set contingencies, right? It's just focused on yourself, but it is a very nice program. If I work with anyone who's a family member, I recommend both of these. I think they're nice. And these can really teach us how to practice the principles that I covered today. So with that, I just wanted to say thank you so much for inviting me back, and I'm open to any questions. Thank you.
Wonderful. Thank you so much. First of all, I just wanted to add to what you've mentioned in terms of resources. We had somebody ask specifically for Canadian resources. So I wanted to point out that I just Googled it. Smart Recovery is available in the US, but also in Canada. And they talk about how their program also incorporates the principles of CRAFT. Do you know for sure, is it comparable to what you've been talking about with CRAFT?
Which
What Smart Recovery is.
Smart Recovery organization. Yeah, I think CRAFT does more specifically, it's more specific training on contingency management. Okay. I think Smart Recovery, I'm like half distracted by the questions and half, but Smart Recovery is a nice program. Smart Recovery doesn't use the heavy abstinence only focus, but I wouldn't say they're largely overlapping in their approach. Smart Recovery versus CRAFT, yeah.
Great, thank you. And I know another Canadian organization that we often hear really good feedback about is called the Families for Addiction Recovery, FAR Canada, and they do a lot of peer support work as well, both for families and for individuals. So I just wanted to throw those two out for people.
So balancing like invasion of privacy versus, yeah, I think it's really hard. And I think it varies. There's very different reactions. I saw someone had a question about adults versus teenagers. I think when you have an adult family member struggling, I err more on the side of like really taking a step back. There's a nice book also through Hazelden and Betty Ford on detaching with love. And it's a way to sort of be able to step back and not get so pulled into sort of the policing, like, I'm gonna catch you. I think honestly, at its core, whether you're a parent of a teenager or a spouse or a child of someone who's struggling with substance use, the more you can catch yourself in that like over controlled, I need to catch you, I need to prove something, I need to go through your stuff, the better, if you can kind of like step out of that framework a little bit. I think again, it's the question that always comes up is what if it's a safety issue, right? Like my kid's driving around, are they drunk when they're driving around? Let me go through their room. There's no right or wrong answer here, honestly. I think when there's acute safety issues, it typically declares itself very quickly, in which case there doesn't need to be a ton of snooping. And outside of that, I think it's sort of like letting go a little bit and letting things unfold and really doing a lot to manage your own anxiety about sort of those catastrophic outcomes. But it's really hard, especially when someone's young in your family and you're there to protect them. So I typically come back to what are boundaries, right? Because I think if we have someone that we love and they're a friend and they're struggling with alcoholism, you don't want to abandon them. You don't want to cut them off entirely, but you do want to do things like if you show up and they start drinking at lunch, leave, right? And let them know. I wouldn't surprise anyone, like I said, with suddenly and drastically changing your behavior, but not being around the person when they're drunk, not bailing them out when they blow things up. And also things like if you have a friend who's really struggling, I'm sure you've been in a position where they are complaining about the same outcome over and over again, like my husband this or my, and not listening to them. Sometimes saying like, it's really hard for me to hear about these problems when I know there's this really big context around drinking when it's happening, right? Like, I really don't want to talk about this anymore. Like, I know you were fighting with your husband because you're probably drunk, right? Being able to set some boundaries, loving boundaries, and saying like, I'm happy to hang out with you. I'd love to go hiking with you. It's that positive reinforcement. Like the next time we hang out, I don't want to do it at a bar. I want to do it at, I want to do something together sober, right? Trying to reinforce where you can. It's harder with a friend and you don't live together, but naming it, like I said, don't avoid talking about it. I think when it's friends, it's even harder to bring up, but letting people know you see it and you love them and you don't want to be around it, but you still love them as a person and you want to be around them when they're healthy and sober. All of those types of things can be really helpful. A great question. I honestly just always encourage really open communication around this subject because some people, especially if they're early in recovery, it can be very hard for them to be around. If they're an alcoholic and you open a bottle of wine in front of them, that can really increase their cravings. But some people are fine with it, right? So I really encourage, I think it goes a long way to just talk to the person and say, I know you're trying to stop. How do you feel about me having a drink? They might say, you know, like, for the foreseeable future, I prefer you don't do it in the home. Then if you're willing and it feels supportive and it feels fair, like maybe you can cut down on doing it in the home in front of them for a while. But really start with asking them because some people really care and some people don't care that much. So called
Love.
Detaching with Love, and you can write Hazelden. It's a treatment center in Minnesota that specializes in addiction, and it's H-A-Z, I think E-L-D-E-N, Hazelden. I think without knowing any details about what happened, we never cause someone to overdose. We never cause another person to die. Our presence or lack of presence is not what drives someone into these really horrible outcomes that we sometimes see in substance use. And I know that's part of the catastrophic thinking. And I think that's what happens when we're traumatized by loss is the first thing we do is look for our role in it. And we find blame in ourselves. And I think it's much more tolerable to think of what could I have done to prevent this than to say like, this was so chaotic and unpredictable and scary. It's much easier to think about what did I do? What could I have done differently? And it's just that in itself is a very natural reaction to trauma across the board, whether it's substance use, whether it's, people dying in accidents, their family members still do this. They think like, oh my God, if I hadn't called her earlier that day, maybe she would have left and driven a little bit earlier. And I think it's hard to say, but I think that that's one of the really painful realities. That's why many people call addiction a disease. Sometimes people do overdose, and it's not our fault. And no matter how much we reinforce or don't reinforce or get into punishment, it doesn't change what happens to people in the end. I think, again, back to just open communication. I think, especially say you have a younger sibling and you have maybe an older sibling who's an adolescent or young adult who's struggling with addiction. And I don't know if that's the question, but that's just where I'll start. When there are, we'll say, siblings in the home, I think one thing we can do that we think is protective that actually winds up not being protective is not talking about it or making excuses, like everything I had on that one slide, pretending it's okay, offering false hope. And I think bye Marco, I think being pretty honest, and there's age appropriate ways depending on how old the person is to do so. But let's say it's a young kid saying, like, some people struggle with taking too much of things that aren't good for them. That's called addiction. Your brother Tommy struggles with addiction. He's working on it. I know it can be scary, and really validating the feelings. Like, we know it's really scary sometimes. If he ever does anything, we're here, we're strong, we can talk to you, you can come to us. Like, if he ever does things that seem weird to you, it's probably related to that, like sort of just being open and age appropriate with your communication around it can be very helpful for family members. That was one I asked. And I think uncertainty is one of the most painful emotions to cope with. I think there's actually cool neuroscience and research on like the uncertainty parts of your brain kind of feel actually painful. I think, again, I know this is sounding redundant, but one is that ability to kind of sit back and watch and observe and not get pulled into like wanting to police and look through phones and try to figure it out. And the other side of that is open communication and sitting down and be like, honey, I know that I've noticed you're smoking a lot of weed and I'm worried. Like that actually can go a long way. And what I always tell parents is your kid will almost always respond to you like, or any loved one. It doesn't just have to be teenagers. I just give that as an example. Almost always will respond to like, I don't know what you're talking about, blah, 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 right? And they will go straight to denial, right? That doesn't mean that conversation doesn't plant some type of seed. And it also doesn't mean that the kid isn't aware that they have a problem. I tell parents this all the time that I work with when it comes to teens. I know I'm using a lot of teen examples. Parents are often the last ones to know that their kids know they have a problem. I'll have people, and this goes for adults too, it's not just teenagers, but I'll have people come to session and be like, I really have a problem. And then we'll get to family therapy and they'll be like, I don't know what you're talking about. All my friends do the same thing. I'm like, whoa, what happened? So sometimes just laying the groundwork of having a non-defensive and non-attacking and loving conversation where you're willing to back off can make the kid more likely in the future be honest about it. So even if you get that initial response of like, oh my God, get off my back, it's way more likely if that conversation goes well for them to be coming clean about it in the future. But no, the fact is you never fully know until it declares itself, which is painful and hard to sit back and wait in those situations. I think doing a lot of coping ahead. I don't think being able to control things, there's always going to be alcohol at family gatherings unless you're part of a group of people that don't do that, or it's not part of your religious beliefs or whatever it might be. I think really it's so unpredictable how family gatherings go. It's a matter of focusing more about you thinking, okay, worst case scenario happens, how am I going to deal with it? Like really playing the tape forward in your own mind and thinking about how you'll cope and thinking like, my husband might do something really embarrassing. Here's what I'm going to do when that happens in my own mind to take care of myself. It's less about controlling the environment and more about controlling your reaction and taking care of yourself. But yeah, I don't know. Holidays are something definitely hard. I know. I think that's where a really good therapist and support group come in. And that is coming back to boundaries. I mean, it depends on who the family member is, but you know, people get divorced sometimes, right? And I'm not encouraging that. I'm not saying that's the right option. Every person is different. People, have kids go to treatment centers, right? There's different ways of setting boundaries, but no, at the core of it, if you love someone that's struggling with something that truly can be life-threatening, like an addiction, it's really, you need your own therapist. I think and oftentimes it clusters in families. So the number of people I work with who have an alcoholic parent and then have a spouse or a kid that struggles with substance use, it's sort of this intergenerational trauma that we need more support for. And I just think if you can, getting in with your own person to process all of it and who can help you think about if boundaries are necessary or if ending relationships were necessary, can happen. I don't know. I think that's very helpful. It's so hard. I mean, so look, I'm a therapist. If I had a kid who was majorly like, I don't know, snorting cocaine every day and I didn't know about it, I would be very grateful to have that information passed along to me. But yeah, it's like you keep saying, it's such a dialectic. There's things, I also get lots of emails from parents where I'm like, stop emailing me. You don't need to pass me along every detail of this week. But no, it's really up to you and it's up to your own personal values. I had a friend who called the police on her dad growing up because he was driving drunk all the time, right? And she said, the next time I know of you doing that, I'm calling the cops. And she did. And it was, I mean, he was really mad at her, but I think she was also really proud. She was like 15. It was a really brave thing to do.
Yeah.
It's really what your own values are around it. And I think it requires a lot of judgment, but I do think to give general guidelines, if it seems to be something that's majorly impacting someone, and you know about it and someone in a care position doesn't, it's not terrible to pass along, but I do think you should do so with great caution and you should let the person know. So I have a rule that if parents email me, they have to CC their kid on the emails they're sending me. And, because I don't want a bunch of side communication, but yeah, I would let them know that I know you're doing drugs and your therapist doesn't, and I'm worried about that. And I think I'm going to let them know.
Thank you so much. Is there one last tidbit or thought that you would like to leave us with?
Take good care of yourselves. And you can plan and you can plan. And of course, it's great to learn different strategies. And at the end of the day, when you have someone struggling with any sort of psychiatric condition, substance use, whatever it might be, health illness, right? It takes such a huge toll. And I think like oxygen mask on yourself first. I firmly believe in that. So the fact that you guys are here, I feel like everyone here could also use the advice to do something nice and like process your own stuff. Thank
I
you.
just want to remind everyone who's out there, if you would like to make a donation to Sash Bear to help us with the programming that we provide. Once again, thank you everybody for joining us. Thank you, Dr. Guller, for being with us tonight and sharing your knowledge and expertise. And I wish you all a good evening.